Mouth cancer, causes and treatment. Oral cancer can appear anywhere in the mouth, including the inside of the cheeks and the gums. It is a type of head and neck cancer. It often comes under the category of oral and oropharyngeal cancer. Oropharyngeal cancer affects the back of the mouth and the lining of the throat. According to the American Cancer Society, around 53,000 Americans will receive a diagnosis of oral or oropharyngeal cancer in 2019. The average age at diagnosis is 62 years old, but around 25% of cases happen before the age of 55, say the American Cancer Society. The disease is more likely to affect males than females. Symptoms. In the early stages, there are often no signs or symptoms of oral cancer. Smokers and heavy drinkers should have regular checkups with the dentist, as tobacco and alcohol are risk factors for mouth cancer. The dentist may be able to spot any signs at an early stage. Precancer. Signs that cancer could develop eventually include leukoplakia. This is where there are white patches in the mouth that do not disappear when a person rubs them. Oral lichen planus. This is where there are areas of white lines with a reddish border, possibly with ulceration. Many oral lesions may be precancerous. They do not mean that someone has cancer, but people should speak to their doctor about any changes that occur in the mouth. Monitoring changes may help spot mouth cancer in the early stages when it is easier to treat. Cancer. If cancer develops, a person may notice patches on the lining of the mouth or tongue, usually red or red and white, bleeding, pain or numbness in the mouth ulcers or sores that do not heal, a lump or thickening of the gums or lining of the mouth, loose teeth with no apparent reason, poorly fitting dentures, swelling in the jaw, a sore throat, or feeling that something is stuck in the throat, a hoarse voice, difficulty chewing or swallowing, difficulty moving the tongue or jaw. Having any of these symptoms does not mean that a person has mouth cancer, but it is worth checking with a doctor. Causes. Cancer happens when a genetic change in the body results in cells growing without control. As these unwanted cells continue to grow, they form a tumor. In time, the cells can migrate to other parts of the body. Around 90% of mouth cancers are squamous cell carcinoma. They start in the squamous cells that line the lips and the inside of the mouth. Risk factors. Doctors do not know why these changes happen, but some risk factors seem to increase the chance of mouth cancer developing. There is evidence that the following factors increase the risk: smoking or chewing tobacco, using snuff, which comes from tobacco, regularly chewing betel nuts, a popular habit in parts of Southeast Asia, excessive alcohol consumption, human papillomavirus HPV infection and especially HPV type 16, a previous history of a head and neck cancer. Other factors that may increase the risk of mouth cancer include ultraviolet exposure to the lips from the sun lamps or sunbeds, gastroesophageal reflux disease or GERD, previous radiation therapy in the head, neck or both, exposure to certain chemicals, especially asbestos, sulfuric acid and formaldehyde, having a long-standing wound or chronic trauma, for example from jagged teeth, drinking very hot made tea popular in South America, following a healthful diet that contains plenty of fresh fruit and vegetables may reduce the risk. Treatment. Treatment will depend on the location, stage and type of cancer, the individual's overall health, personal preferences. There are a number of options as we describe here. Surgery. A doctor may recommend surgery to remove the tumor and a margin of healthy tissue around it. Surgery may involve removing part of the tongue, the jawbone, lymph nodes. If the procedure significantly changes the person's appearance or their ability to talk or eat, they may need reconstructive surgery. Radiation therapy. Oral cancers are sensitive to radiation therapy. This treatment uses beams of high energy X-rays or radiation particles to damage the DNA inside the tumor cells, destroying their ability to reproduce. External beam radiation. A machine targets the affected area with radiation beams. Brachytherapy. The surgeon will use radioactive needles to deliver radiation to the tumor inside the body. A doctor may recommend this for people with early stage tongue cancer. Adverse effects of radiation therapy in the mouth may include tooth decay, mouth sores, bleeding gums, jaw stiffness, fatigue, skin reactions such as a burn. Treatment will likely be more effective in people who do not smoke or have already quit. A person with early stage mouth cancer may only need radiation therapy, but a doctor can recommend combining it with other treatments to reduce the risk of cancer progressing or recurring. Chemotherapy. If cancer is widespread, a doctor may recommend combining chemotherapy with radiation therapy. Chemotherapy involves using powerful medicines that damage the DNA of the cancer cells. The drugs undermine the cell's ability to reproduce and spread. Chemotherapy medications destroy cancer cells, but they can sometimes damage healthy tissue too. This can lead to severe adverse effects. These effects may include fatigue, nausea and vomiting, hair loss, a weakened immune system and increased risk of infection. These effects usually go away after a person finishes their treatment. Hypothermia therapy. In this emerging technique, a doctor will heat the area above normal temperature to damage and kill cancer cells. This therapy method can also increase the sensitivity of the cancer cells to radiation therapy. Prevention. To reduce the risk of mouth cancer, people should avoid using any form of tobacco product. Avoid excessive alcohol consumption. Avoid chewing betel nut. Have a regular dental check. Monitor for changes in the mouth and see a doctor or dentist if any occur. Have the vaccination to protect against HPV or human papilloma virus. Doctors are finding evidence of a link between human papilloma virus and oropharyngeal cancer. Complications. Mouth cancer and its treatment can lead to a range of complications. Complications after surgery include the risk of bleeding, infection, pain, difficulty eating and swallowing. Long-term problems may include the following: narrowing of the carotid artery. This can result from radiation therapy and may lead to cardiovascular problems. Dental problems. This can develop if surgery changes the shape of the mouth and jaw. Dysphagia or difficulty swallowing. This can make it hard to eat and may increase the risk of inhaling food and subsequent infections. Speech problems. Changes to the tongue, lips and other oral features can affect speech, mental health issues, depression, irritability, frustration, and anxiety may arise. Joining a local or online support group can be helpful. This contact offers the opportunity to meet people with similar experiences.